In a quiet and clean practice room, a dermatologist prepares sterile equipment to treat his patient's face. The patient sits comfortably in the examination chair, while the light focuses on the parts of the face that are full of blackheads, especially in the nose and chin area. In his hand, the doctor holds a special tool shaped like a needle, which is used to clean blackheads with a precise and safe technique. With great precision, the doctor begins to approach the clogged pores. The small tool is carefully guided over the blackhead, and with very measured pressure, the doctor pokes lightly at the surface of the skin to open the pore. One by one, blackheads are removed without damaging the surrounding skin tissue. Occasionally, the doctor wipes the cleaned area with a sterile cloth soaked in antiseptic, ensuring that each pore remains clean and free of infection. The doctor's hand movements were smooth but precise, showing skills that had been honed over many years. Patients feel comfortable even if there is slight pressure on the skin, because they know that every action is carried out with great care. After a few minutes, the cleaning process is complete. The doctor gives the patient a little explanation about how to care for the skin after the procedure, ensuring the skin remains healthy and well cared for. The patient's face now looks brighter, cleaner, and free from the blackheads that have been bothering him.